Hi everyone, my name is Alicia Snyder. I'm going to give you my speech to you today about strokes. What can happen if you have a stroke, the steps to take to identify a stroke, and what to expect following a stroke. The National Stroke Foundation told a story about a 39-year-old mother of two, Maureen Leschant. Now, she was home with her children one day when she received a call from her husband. Her husband was having difficulty understanding her, so he asked her, "Honey, why are you talking funny?" Now, she had no idea what he was talking about. He had her do the FAST method to see if she was having a stroke. When she failed the test, he said, "Hun, you are having a stroke. I will be there in 5 minutes." Within 5 minutes, he was at their house, and within half an hour, they were at the hospital. 2 years later, she is fully recovered from her stroke and travels around America to inform people of the FAST method and how accurately it can help you identify a stroke. The CDC states that 130,000 Americans die every year as a result from having a stroke. Now, what if I told you that 80% of all strokes are preventable? If people took the proper precautions and steps to make sure that the risk factors were under control, stroke-related accidents would be far and few between. A stroke happens when blood flow to part of the brain stops. The National Stroke Association says that if blood flow to part of the brain is stopped for more than a few seconds, blood can't get to the brain cells begin to die and can cause permanent damage, which you can't get back. A stroke is the third leading cause of all deaths in Americans, and the most leading cause of long-term disability of adults. The chances of having a stroke doubles every decade after the age of 55. While strokes are common with the elderly, everyone under the age of 65 can still have strokes. There are two kinds of strokes, the ischemic and the hemorrhages. The ischemic is when blood flow to part of the brain is blocked or plugged, caused by a blood clot in the blood vessel. It accounts for about 80% of all stroke cases. Now, the other type of a stroke is the hemorrhagic. It happens when a blood vessel in the brain ruptures, which spills blood into the brain. It accounts for about 20% of all stroke cases. Each year, more women die as a result from having a stroke, and more women have strokes than men. The use of birth control pills, pregnancy, history of preeclampsia, and smoking all factor into more women having strokes than men. 80% of all strokes are preventable. So managing the risk factors must be taken into consideration to prevent you from having a stroke and to protect you from having another one. Those risk factors include high blood pressure. Make sure you take your pills on time. Check your numbers. Make sure you inform your doctor of any changes. Atrial fibrillation, again another one. Make sure you take your medicine on time. Inform your doctor of any changes. Smoking. You gotta quit smoking. There are tons and tons of programs out there that can help someone quit smoking. If one doesn't work for you, try another one. Ask your doctor. Odds are that they have great advice for helping someone quit smoking. Physical inactivity. Get out there and walk. Your doctor can refer you to a nutritionist and a dietitianist to help you get a plan that works for you. More than half of all stroke cases result from high blood pressure, making it the most important risk factor to control. Disabilities can happen as a result from having a stroke. Although a stroke is a disease in the brain, it can also affect all of the body. Effects that can happen can range from mild effects to severe effects. And those effects can be paralysis, difficulty speaking and listening, understanding. It may cause pain and numbness following a stroke. 20% of all stroke victims have minor impairments after a stroke. 40% of all stroke victims suffer minor to severe impairments and require special care. 10% of all stroke cases require the patient to be in some kind of nursing home facility or a special care facility to help them recover from the stroke. Lifestyle changes can prevent you from having a stroke and protect you from having another stroke. You may be at a greater risk for stroke if your mother, father, grandparent, brother, or sister has had a stroke in the past. The National Stroke Foundation says that there is a test you can do to identify if you are having a stroke. Just like Maureen and her family have done. It is called the FAST method. A-F-A-S-T. FAST. Those break down into face, arms, speech, and time. Now I have this little paper right here. I'll pass it out to you guys if you can help me. It just says what FAST is and has a little diagram. FAST stands for F, face. Have the person smile. Is one side of their face drooping more than the other, or is it numb? A stands for arm. Have the person put their arms out to the side. Is one arm droop more than the other one, or does it feel numb? Speech. Have the person recite a simple sentence. The sky is blue. Can you understand what they're saying? Is their speech slurred? And the last one is time. If the person has showed any of these signs, no matter if they have gone away or not, get the person to call 911, get the person to the hospital. Make sure you write down the time, or keep it in your mind, memorize the time that their stroke has, the onset of the symptoms of their stroke has happened. When you first noticed that part of their face was drooping or you couldn't understand what they were saying, write that time down. Get a mental note in your head of the clock, what it says. You can inform the nurses and doctors, and they can calculate how long it's been since the onset of the symptoms have happened, because if they receive treatment within the first 60 minutes following the stroke, the disabilities can be stopped. Now, with all the information I have given you today, you can now be prepared to identify when someone is having a stroke, the steps to take following a stroke, and how to protect yourself if you think someone you love or yourself is having a stroke. Thanks, guys. Is there any questions? Nope. Okay. Bye, guys.